Hey guys, so I just wanted to give you an update about Cydney. She did end up having both her lip and tongue ties revised on Thursday. Her lip was a level 4 and her tongue was posterior, but really impeding any type of movement for her tongue. So basically she hasn't been nursing correctly at all or being able to use it. She just has been living off of the letdown of my oversupply. So once that would regulate, then she would definitely not have enough milk because she's not emptying the breast fully and she's not stimulating any milk production. So thank God we got that done. It was really sad because I couldn't be in there with her. She explained the procedure, she went over things, she looked over, she checked her out and evaluated her ties. Then they put her in a little swaddle blanket and put little glasses on her to protect her eyes from the laser. And then I had to hand her over. That was really hard. And leave the room. And they used a laser to, go through the tissue of those. They put a numbing gel on first. So I don't know if her screams were actually pain that, wasn't covered by that, or if she was just really scared to be held down and have someone mess with her mouth. So, and then, it numbs for like 6 hours, and so she was just sleepy and kind of sad, and I had to drive home. It was like a 2-hour and 40-minute drive, and it was really sad because I just wanted to, nothing more than to just cuddle with her, but I had to drive, and I was all by myself because Chris had to work. And he couldn't get off because he took all the other days off for when she was born. So it was like, well, he can't lose his job over this. So, but it was really hard. The kids were at a friend's house, and that went really well. And then, so it didn't wear off until 9 o'clock that night. And she was a little fussy, but she was so tired that we were able to work through it. We've been using Highland's teething gel, arnica tablets, and essential oils to help manage the pain and her comfort, keep her calm, and, lots of skin-to-skin and breastfeeding. The last couple days, she seemed okay. We worked through it. We have to do these stretches of the wound so they don't reattach, and that is horrible because we're such attached, close parents and to the babies, and to have to cause her pain is just heart-wrenching. I just don't like doing it. It makes me really sad. I don't want to. I don't want her to, have me hurting her. It's really sad, but at the same time, I don't want her to have to go through that again. So we've been doing that, and that's going well. Her wounds are healing well. Well, I mean, they look okay. I'm not sure if they're doing much healing yet, but and so she's been pretty comfortable, except yesterday, which was Sunday. She seemed really, upset all day, no matter how much stuff that we tried to manage the pain with. And she was kind of resistant to nursing. And so I don't know if her muscles that she's newly using are just kind of taxed out, or if her pain was just more significant. And so I did co-bathing and skin to skin, and I was able to get her to nurse. But she's, just really kind of resistant still. She doesn't want to turn her head a certain way too, so I think there's a lot going on there. So I am bringing her to another craniosacral therapy and chiropractic appointment today because that helps a lot with that. So hopefully we get some success after that. Last time it really helped. I took her the day before her surgeries. So it's really good to, have that go along with it. So hopefully that helps when I bring her today with the nursing and the latching. I mean, we weren't expecting the latch to improve immediately. They say that however old they were, add that, that's how long it's going to take for things to improve. So she was like 5.5 weeks or almost 6 weeks, so we should expect 12 weeks before things get better, which is kind of frustrating. But I guess it could be a lot longer till things get better. I also I'm going to go see a lactation consultant to help with the latching issues because she's still not opening her mouth fully, her lips aren't flaring out, and she's not really using her tongue yet. She still has a shallow latch, and she's swallowing air and such, and it's leaking out and not good. So I mean, she's getting milk right now and she's gaining weight, which is great, but at the same time we need to work on that, so for long term. So, and we didn't go through, we need to make sure that we work with her constantly. This is going to be a long road. It's not just a simple quick fix. Anyway, but I just wanted to update. She is doing okay. There were no complications. She's a little, I mean, she smiles anyway. She's a little trooper. So anyway, the kids are trying to come in. So I just wanted to update really fast. Thank you for the thoughts and prayers, and keep them coming, that, you know, nursing can be more successful. It's really frustrating, and just trying to work through it. So talk to you guys later. Bye.